Total shoulder replacement. The shoulder joint is where the ball-shaped part of your upper arm bone, or humerus, meets the cup-shaped socket of the shoulder blade, or scapula. A group of muscles and tendons hold your shoulder joint together. These muscles and tendons are called the rotator cuff, and they enable you to move your arm and shoulder. With traditional total shoulder replacement surgery, the ball of the humerus is replaced with an artificial ball. The socket of the scapula is replaced with an artificial socket. The new joint still uses the rotator cuff muscles to move the arm and shoulder. With reverse total shoulder replacement surgery, the ball of the humerus is replaced with an artificial socket, and the socket of the scapula is replaced with an artificial ball. Since the rotator cuff muscles are altered with this approach, another muscle, the deltoid, moves the arm and shoulder after surgery.